Well, good afternoon, everyone. A very warm welcome to our brand new webinar series from the Stewart's Injury team. The theme, as you all have seen, because you've all signed up, is sexuality, reproduction, and intimacy after spinal cord injury. So this theme, I'm just going to chat for a minute or two while people join. This theme came about after lots of discussions and trying to ensure that what we're producing is useful content. And this theme um, came up again and again as being a topic of interest and something that maybe isn't discussed in as much detail as people would like, or there's just not a huge amount of information. I think that's getting better. And Nicola, you can pitch in on this in a minute. But I think that is improving. But I think that there are so many perspectives here, um, that we can look at in addressing this topic. And so this series is aimed at providing a useful overview from all different types of perspectives. And one of the most important perspectives, obviously, are first-hand accounts. And that is something that came up again and again in preparing for the session, that actually the people who know best are the people who have lived through some of these issues and have something really meaningful to say, which is where we bring Nicola in, because she has amazing insight and such a brilliant journey to tell us about today, and so many learning points. And the point of this is to kind of inform and help educate, or just to provide some takeaways. And I was just saying to Nicola before we started that, since our initial discussions, I've been reflecting on my own practice and thinking about different things that I hadn't considered before. So that's the aim of today. But everyone's here to hear from you and not from me, Nicola. So I'm going to stop talking. But just by way of introduction, Nicola Cundall is and also is now married, so it's actually Nicola Manning, nee Cundall. If anyone's searching for on socials or anything like that. Um, so Nicola's an HR business partner. She's also the chair of the charity Spine, which operates to support patients at Pinderfield Spinal Unit. She's a mum, all of those things. She's a superhuman. And Nicola sustained a spinal cord injury when she was 18. She's going to tell us more about that. And she's really kindly agreed to come today and just tell us a bit about her experience, with a specific focus on her IVF journey, motherhood journey, all of that stuff. So, welcome, Nicola, and thank you so much.
Thank you for having me.
No,
Excited to be here.
it's an absolute pleasure to have you. I'm excited for everyone watching because I already know some of the things that you're going to say, but I'm excited for everyone else to hear. And I thought just a good way to start, Nicola, just a good way to kick us off is just to tell us a little bit about the background to your injury, the level of your injury, to the extent that you're comfortable to do that.
Yeah, 100%. So I, as you mentioned, had my accident. I just turned 18 years old. It was back in 2004, so you can probably work out how old I am. So I've been, post-injury for quite some time. It was a car accident, quite a severe one. So I was driving along a road with some blind summits, lost control, snaked, hit another vehicle that was oncoming, went up a grass verge, the car spun, hit a tree at 8 foot and then came down on its roof. Luckily, there were other people in the car. I was the driver. Luckily, I was the only person who was injured in that. But the injuries were quite extensive. So the spinal cord injury is probably the thing that affects me most long term, obviously, because I'm a full time wheelchair user. But initially, I mean, it was the internal injuries. So I broke my jaw, both my arms, my spine. I broke a L3, but the nerve damage sustained because of the swelling was T11, so deficits T11. I broke ribs, pelvis. The seatbelt went through my abdomen, so I had lots of internal injuries. Ended up having quite a lot of bowel removed. I got sepsis, sepsemia, MRSA. My lungs started collapsing. My kidneys started failing. I was in a coma for just under 6 weeks, I believe, in ICU for just under 8 weeks, and then I went into Pinderfields for around 14 months. So subsequently, following years, I have picked up things like DVTs, pulmonary embolisms, osteoporosis, um, bowel adhesions which cause obstructions, and then quite severe anemia. So there's kind of quite a lot of things going on
Yeah.
from the perspective of that kind of thinking about motherhood, etc.
Yeah.
It's not just a spinal cord injury. So
Yeah.
um,
Which you don't appreciate at the time, do you? I mean, you don't, we have all of these horrific injuries, and of course you're adapting not only initially to all of your physical impairments, but everything else going on around you. And you don't think necessarily about how, these really severe kind of abdominal injuries, for example, are going to cause, and we'll come to that because we talked about that in the context of kind of birth and all that. We will come to that. But I mean, it's a horrific checklist of injuries, Nicola, and you kind of rhyme them off because you've lived with them. But taking a step back and looking at all of that, it's just a huge amount to deal with. And your circumstance, we've already said you're 18 at the time of your accident, so just your circumstances at the time, you're still in school.
yeah, I'd gone to college, I'd done my GCSEs, started doing my A levels. So I was in the second year of my A levels when I had my accident. Obviously, being kind of acutely injured to such an extent that I wasn't able to kind of follow through with my A levels in that year.
Mm,
And then when I kind of got into a position of thinking about the future, I was
mm,
still in hospital at the time.
yeah,
But because I was over 18, I couldn't get any of that educational support. So I essentially had to sort of teach myself through my second year of A levels because I knew I wanted to go to university. Um, and again, that just sort of put me in a headspace of you sort of thinking about, okay, well, what do I need to do to get through this stage of hospital, you know, events, this next stage of hospital events? Okay, well, you're kind of dealing with each issue at a time. Or that's how I managed it. It's kind
yeah,
of what's happening now. And then I started thinking about the future. And that was around mainly sort of that education perspective,
yeah,
which did mean that from I suppose you'd call it a family planning perspective,
yeah.
that
Yeah.
wasn't something that was in my mind immediately.
No,
Um,
of course not. But I think, and actually, it's a good kind of reminder that someone who, even at the fresh age of 18, and you're sitting doing your A levels and coping with everything you were coping with, that was still something that was in the back of your mind, or maybe at the forefront of your mind when it came to it at that very early point. Because I think maybe otherwise you maybe wouldn't have at 18 thought about any of that sort of thing and hadn't expected to think about any of it, and now
yeah,
you're kind of forced to think about it all.
a
Um,
100%. And there's physical things as well. So like my period stopped while I was, it's certainly like throughout the time of obviously ICU, Pinderfields. So I was sort of starting to think about, okay, so this is having an impact not just on what's going on in the here and now, but also things that I wouldn't necessarily have identified as having an effect on, if that makes sense.
yeah,
Particularly at that time, I was 18.
yeah.
So
So you think once you'd kind of moved out of that acute phase and you were spending more time probably on the unit and doing your rehab and all of that sort of stuff, you were thinking about it more. What sort of discussions did you have in relation to sex, sexuality, reproduction, and all of that? I suppose, and I suppose I mean then with clinical people on the unit. I also mean with family. I also mean with peers. What were there any discussions around that?
I think from a family perspective, definitely not,
Yeah,
because everybody was just trying to kind of get me through, again, that kind of acute period. From a clinical perspective, it definitely came into my mind. And I remember having a conversation with a consultant saying, you know, I'm not thinking about it right now because I want to go to university. There's things I want to do. But will I be able to ever have children? The response that I got was, and I'll never forget the words, well, we'll just cross that bridge when we get to it. And that was the response that I got whenever I asked in the following years as well. And I think, again, you kind of alluded to it before. I think now it would probably be different, but this was obviously my experience
Yeah.
22 years ago up until, well, fairly recently, I suppose. But it was basically, we'll cross that bridge when we come to it. So the conversation was shut down. The most I ever got um, was a urologist saying, well, there's probably physically not a particular reason why you couldn't.
Yeah.
So it was a very kind of washy response. Nobody wanted to get into it with me.
Yeah.
And so from my perspective, that then meant, I was 18 when I had my accident. I went to uni straight from Pinderfields. So I was kind of having or wanting to kind of have relationships with people.
Yeah.
And not that at that point I would maybe have wanted to have that such a serious conversation about, well, do we want to have kids? But certainly as I'd kind of left uni, got into kind of full-time work, bought my house, that was something that I was wanting to have conversations with the
Yeah.
people that I was in relationships with about,
Yeah.
we couldn't have the educated conversation around can we build a family because I never got the answers from that clinical perspective around whether it was a possibility.
Yeah. And you felt, well, I've got two questions actually. Which one should I ask first? You felt, I've got so many questions. I'm so sorry. What, was there such a thing as kind of peer support at the time? Did you have other people in the unit that you spoke to about it, or was it just not something discussed, or?
When I was on the unit, not so much, although there were people that tended to come back to the unit to kind of give that peer support. My experience was they weren't generally women. They weren't generally people who had kind of gone through that childbirth experience. So I knew of a couple of people perhaps who had a spinal cord injury and had gone on to have a child, but I had no way of contacting those people, didn't know kind of surnames.
Yeah.
It's just kind of, that heard of them sort of scenario. So I knew that it was a possibility for some people,
Yeah.
but I didn't have access to those people.
Yeah.
Um,
And it's a really good point, isn't it? Because, the sexuality and reproduction stuff is different depending on your age, whether you're male or female, or, I mean, the issues are just so wide ranging. And hopefully, and this obviously today we're talking about female health. In other episodes, we'll talk about male health. But it's an interesting and important point that you make in terms of peer support being kind of coming from somebody
mm,
who knows best. And yeah, and the other thing I wanted to ask you as well about kind of specifically, if you don't mind, talking a little bit about, because you're married, and I want to talk a little bit about when you met your husband and the kind of what early discussions were like with your husband about having an intimate relationship and having a family, because your circumstances are unique in that way.
yeah, so I met my husband through the spinal unit. So in one of the years I was at uni, and every year of uni, I ended up back in hospital for 3 months because something happened, whether it be pressure sore, blood clot in my lung, or whatever. And so one of the episodes that I was back in Pinderfields, he was a newly spinal injured patient.
Okay.
So I knew of him for a long time, but we were both in different relationships, different stages of our lives. And so we never got together at that point. Um, and it was it 10, just over 10 years ago, where we just kind of reconnected. We were both single. He'd grown up a bit. I can't say he's grown up completely.
No shade.
But yeah. But yeah, he'd kind of got out of his boisterous phase, and was at the point, I think we were both at the point where we were ready to settle down. So we started talking about the possibility of having a family really early on. And it's interesting because he was obviously injured after me, he's male. He had a much more direct route in terms of they knew he'd have to go through an IVF process. He'd already had sperm frozen, And so that consequentially meant for me, I was in an IVF process because of my partner, not because of myself,
Got
but
you.
it almost helped just by kind of falling into that scenario, almost helped from my perspective because it meant that I could start having some of the kind of medical conversations about what the problems would be, what the risks would be, and whether it would be possible.
Yeah.
So yeah, we are an interesting scenario, the two of
Well,
us.
as you say, it's hugely complex, but you felt like you had that kind of degree of clarity, I suppose, about what your options were. And maybe, the conversations might have been, or probably would have been totally different if you'd met someone without a spinal cord injury and, that, well, we can't guess what would have happened then, but it's interesting thinking about the how niche and bespoke, each set of
Yeah,
circumstances. And that makes it
absolutely.
so hard for injured people and for clinical people and kind of everybody in between to
Yeah,
to provide the right education.
100%. And we did have, so we were in the IVF process. It took 7 years for us to get to the first attempt just because of, well, there was COVID in between, but Nathan had to wait for operations, but they had to do a lot of investigations around what was going on with me as well. And in that time, we did actually fall pregnant twice. Unfortunately, I miscarried, but that gave me almost an experience of what it would have been like outside of the IVF process. Because one of the biggest issues for me at that time was I was on medication at Pixaban that they would have taken me off during the IVF process because they don't advise you take it while you're pregnant. But I couldn't get anybody to commit to taking me off the medication. I knew I needed to be on a heparin type, so I knew what drug I needed to be on.
Mm.
And I was having that conversation first with my GP, who said, "Well, no, we can't do that for you.
Mm.
You're in the IVF process. Talk to the IVF people." They couldn't do it because I hadn't started the process of IVF, i.e., taking the medication. So they'd sort of washed their hands of that. And then I went to Pinderfields, last chance, sort of thinking, well, where do I go?
Mm.
And Pinderfield essentially said, go to your GP, but my GP still wouldn't do anything about taking me off that medication. So I was essentially in a limbo where I had to continue taking a medication to prevent me from clotting that I knew could have a detrimental impact on the pregnancy. And so obviously I'll never know whether it had actually had an impact or not. But it was, almost like a real life out of IVF natural process
Mm.
that showed me the challenges of what would have been had I not been with someone who needed to go through that IVF process.
Yeah. And I mean, I was kind of staggered. I'll be honest, like whenever, when we talked about this and you said it had taken you, because I thought you were going to say it took me 7 years and then the baby was here, but it took you 7 years just to get to your
Yes,
attempt. And that's
yeah,
because, from what you're saying, that's because you had all of these kind of complications to deal with, various things over time.
yeah. And when they did the egg retrieval from me, then because my internals are not where they're meant to be, they've nicked bowel, so I got internal bleeding and sepsis from that. So and before they realised that my bladder and bowel had gone to sleep, so it was just kind of complications, I suppose, at each step of the way. They found a couple of cysts, so they had to check those. But again, that was a bit traumatic because I didn't realise what it was they were looking for, and then I just got sent to the Bexley wing at Leeds, which is obviously a cancer unit. So I was panicking, thinking, "Oh my god, they think these cysts are cancerous," and nobody sort of mentioned it. And so yeah, it was all quite eventful and a long process. And they had to repeat because it was taking such a long time.
Yeah.
Then by the time we were getting close, we'd have to repeat things that we'd done earlier in the process,
Mm.
just because they'd expired and they needed to be done within, recent timescales. So it was definitely a journey,
Yeah, yeah.
to say the least.
Did you have an overarching kind of point of contact? Did you have, I'm thinking about you know generally, having a baby and being kind of with a particular hospital, and you've got the main person the main clinical person that's kind of overseeing you. But it sounds to me like you didn't really have the benefit of that kind of key person, because you're in between the spinal unit and the GP and the IVF people, and you're kind of between services. Did you feel that there was kind of a lack of maybe communication or continuity between those services?
Yeah, at times we definitely had a key contact within the IVF process, and they
Yeah,
were super supportive. It was somebody who kind of had experience of quite unique cases. So it was when things, I suppose, crossed into that kind of threshold, that's when it just got a little bit difficult, I suppose,
yeah,
from our perspective. So, like the medication issue, people could communicate, but everything takes such a long time.
yeah,
Um, so I suppose that kind of communication flow could definitely be, if I were to think about improvements, could definitely be kind of helped. You know, when you're waiting months and months and months from a letter from this person and this person and this person, that's when things kind of start
yeah,
to drag, I suppose.
yeah. And yours and your husband's headspace are occupied, aren't they? With, fully with all sorts of considerations, that you're not kind of actively chasing people and doing things. And I wanted to talk a little bit about your pregnancy, if we can. Um, because you did get pregnant. And I just wanted to talk a little bit about, first of all, I suppose this is a separate question. So kind of education for you, whether that you had some education kind of in terms of carrying a baby as a spinally cord injured person.
So there was no education around carrying a baby as a spinal cord injured person. I describe it as almost like a suck it and see, as like brash a comment as that is, but I really didn't know what to expect. I was anticipating, at some point a large bump which would hinder kind of transfers and make dressing really difficult and things. But as it happens, um, our baby remained really small throughout my pregnancy and was sat in such a position that I never really actually developed a bump. I did, because I've also had a cystoplasty. So I did develop quite a lot of kind of UTIs throughout the pregnancy, um, pretty bad morning sickness. But in terms of the impact on my actual spinal cord injury, it was pretty limited because he was so small. And I almost feel like he did that on purpose, like just to make my life a little bit easier.
Yeah.
Um, but yeah, like so he was sat on my bladder, which obviously causes issues because although I've got feeling, I can't hold anything. I'm not catheterized because I'm incomplete at T11, and I do have that sensation and can kind of void in the bathroom. So, but obviously with a baby laying on my bladder, as that pregnancy progressed, that did become trickier to manage. And I was working full time, so it was kind of like
Goodness,
dealing
Nicola.
with these different things. And then, me and my husband, because he's spinal cord injured as well, he's quadriplegic. So we help each other. So there's that sort of dynamic as well. So yeah, there was a lot going on, but because of the two previous miscarriages, I didn't feel like I could enjoy the pregnancy because I was constantly kind of worried.
Yeah.
Um, and in the latter stages, because he wasn't growing as they'd expected, and there wasn't really any reason why. So they checked kind of the blood flow, the placenta, everything that they kind of needed to check, and there was no real reason why he was not growing as would be expected. But as the kind of pregnancy moved on, it got to a point where I was having either an ultrasound or heart monitoring on alternate days. So it gave me a bit of peace of mind in that I was getting to see him um, every day. But the conversations with me with them were around, well, he's too small to kind of, I suppose, sustain himself if anything goes wrong at the moment. So we need you to identify if there's any restricted move or reduction in movements, and then you need to get yourself in straight away. So that was kind of, it felt like a lot of additional pressure, um, because he wasn't in a pattern of movements either. It was really sporadic. So I felt like I had no kind of way to really anticipate, okay, is he just having kind of a chill, or is there something that I need to be kind of looking more at now? So I was asking basically from about, I think, maybe 33 weeks ish, maybe earlier. Can we just get him out? And at least then we know where we are, we can see him, rather than us kind of being in a not knowing sort of perspective. So yeah, it was difficult because it had taken us so long to get to that point that I didn't want to get to that stage and then be in a position where actually we've lost him. So yeah, it was a really kind of tricky time. Um,
I mean, pregnancy generally is incredibly anxiety inducing in so many ways. As you say, someone will say to you, "Oh, let us know if movements change," and you think, "Oh my goodness, I don't know. I haven't been paying attention, or there just isn't, there isn't
yeah,
a kind of pattern." And you might try and write things down and it just never goes to plan. So it's already, high anxiety kind of situation. And then you have so many layers on top of that. And from a psychological perspective, I think it's all there's always this thing in your mind when you're pregnant of thinking, right, I'm gonna be calm and I'm gonna be
yeah, yeah.
Zen mom, and we're just going to go with it. And so you try to kind of maintain that, and everyone thinks that's really good for your baby, and all of that sort of kind of good stuff. And that just can't have been the reality for you. And did you have or feel that you needed kind of that additional layer of support? Was that available or ever even kind of discussed? Or
Um, it definitely wasn't discussed, despite the kind of events that had led up to it and how difficult it was during the pregnancy. I was quite calm because I think I was in a position of, and maybe it's due to everything that I've kind of been through as a whole, but I was sort of in a headspace of whatever happens, happens. I'm doing everything I can to make sure that, we get a positive outcome. But I almost felt like just the pregnancy itself and the fact it had got to the point that it had got to was a blessing. So I was trying to just appreciate every kind of point that I was at.
yeah.
Um, and so I was worried, but maybe not to the extent that it was, it definitely wasn't crippling for me. And what helped was um, initially, when I'd got pregnant and started meeting like consultants and things at the local hospital around the pregnancy, um, I was seeing different people at every appointment. And so I was spending nearly the entirety of the appointment talking about my own medical history
Mm,
because they felt like they needed to know and understand that
mm.
to then be able to kind of comment on current situation. But we weren't getting time in any of the appointments to talk about the pregnancy, the baby. So I was kind of feeling like we're wasting time in my appointments and I needed some continuity of care. So when it was Calderdale actually appointed again like a complex care specialist, obstetrician, to see me at every appointment, that's when things really kind of started to sort of, I'd say stick, but I felt like I was being heard, understood, supported because we were having progressive conversations, not about me and my medical history, but about solely focused on the pregnancy, the baby, next steps, that sort of thing. So it was a lot more productive at that point than it
And
had
what
been.
what point was that, Nicola? How far along were you when that happened?
I might have been about 20 25, 26 weeks at that time.
Yeah, which is quite
And
a
I'd
long
been,
time.
yeah, because I think they'd noticed at 20 weeks, obviously, that he wasn't growing properly. So I was having pretty regular appointments. Um, and yeah, it was just frustrating
Yeah.
seeing loads of different people.
And for mothers in a similar position to you, maybe that would that be something you'd say, if you don't have that in place, ask for it, push for it,
A
because
hundred percent,
yeah,
yeah. In the event it ever happened again, which I mean, they've said to me, don't do it. But that's one of the first things I would ask as soon as I went into those appointments is, and like, I need some continuity of care, in order to have real meaningful conversation about the situation we're in now.
yeah. Can I ask how I'm not going off topic slightly, but I'm interested to know how your husband felt in all of this because obviously he's got a lot less kind of physical control of things, although you don't really have control, do you, when you just kind of have to, as you say, just kind of
Just
go
go with
with
the
it.
flow.
Did he feel you have described yourself as being kind of accepting, and that's probably a symptom of you having experienced so much medically before that you felt maybe more calm than other people might, but how did your husband cope with it? Did it have an impact on your relationship, positive or negative?
That's a really interesting question. I think it was difficult for him, um, just knowing how to kind of support. I think he was maybe more worried than me, but feeling like he couldn't really show it because he didn't want to make me more anxious in that scenario. I also think for him, being quadriplegic, he was also thinking about, well, what happens when baby gets here?
Afterwards,
So
yeah.
that was a lot of kind of the focus of his thought, and I suppose just general mental headspace at that time,
Yeah,
because we were
absolutely.
anticipating some of those difficulties.
Yeah, yeah, absolutely. And we will come to that. But can we talk a little bit about birth? But about
Oh
your
yeah,
birth, is that okay?
yeah,
You can feel free to tell me to mind my own business, but this is actually a part of the conversation that we had previously in preparing for this episode, and I thought that it was really interesting hearing about kind of um the birth itself, but also kind of your planning and if you can ever really plan for any birth. But
yeah.
if you could tell us a little bit about that.
So the plan from a hospital perspective was amazing. So we had a multidisciplinary team. So it was like the leads from each area. So we had someone from neonatal because they knew that he was going to be small and he'd have to go into neonatal. Had someone from labour ward. We had someone from communities. We had kind of a matron who oversaw the that kind of entire ward area, and it was really, really well connected. They were already talking to anaesthetists, haematology, because obviously, again, I've got quite a lot of kind of comorbidities, I suppose you'd say. So, in terms of that preparation, it was so well planned. They knew they'd had conversations with me about, okay, well, the labour ward have got rooms with en suites, took me into that. We had a look around. Would this be suitable? Yeah, this is great. Okay, well, you can stay here for the entirety of your kind of hospital stay if that works for you. So I never moved on to a maternity unit. I was always on the labour ward because it met my needs. I went and had a look around and so did they included my husband in this conversation as well, around the neonatal ward. So they brought out cots for us to see which might be more suitable. Obviously, he was in an incubator initially, but once they progress, we actually ended up using a twin cot that we'd kind of identified before he was born that would be more suitable for me and Nathan. They looked at kind of what room to put us in so that we could both get our chairs on either side of the baby and have enough space to kind of get around. They talked about, would Nathan need support? Because obviously they didn't really realise what support Nathan needed. Um, but they asked the questions. Do you need help? If you need to go to the loo here, will you be able to use a loo? Is there anything we need? you'll have, like for me, I'd just had surgery. So they were thinking about, will you need a riser for the toilet? Does Nathan need support feeding himself? He doesn't. But they asked we were in that space where they were planning, as soon as they knew what was going to happen, they were planning, okay, well, how do we make this work for the people involved? Um, and there were also restrictions on kind of people coming into neonatal at that time, but we could bring in support to kind of help us if we needed it. So the planning was really, really good. Um, I couldn't, in fact, it's the best I've ever experienced
And
from
you can,
yeah, and
that
I've
must
been in
be,
lots of hospitals.
yeah, and that must have been massively reassuring as well from your
Yeah,
perspective. You felt like somebody's in control. We've got a plan.
yeah, exactly. We've got a plan instead of like, and I am quite a go with the flow sort of person because I know the struggles that the NHS has got. I know how unique not just my own personal circumstances are, but my husband's as well. So I manage my expectations, and again from the experiences I've had. But that was just unbelievable. It was, and social workers. We'd had conversations with social work prior again to the birth of our child about what support might you need, how when we're going to put that into place, and it was all kind of just conversations with us, nothing put on to it. We're just kind of getting asked
Mm,
in a nice, supportive way, what do you need? And so it made the whole experience amazing. I knew it was going to be a planned C-section because he'd not grown. They were expecting him to be under £3, and so they didn't feel that he'd manage a usual vaginal birth. So it was planned C-section. Was he 34 weeks? So yeah, he was 3/6 when he was born. I was put to sleep completely because they anticipated they might have some problems. Um, and it took 45 minutes to get him out
oh
when it would
wow.
normally take three. And then in complex scenarios, they say 6 to 10. And then I was in there for another 5 hours.
I mean, that
So,
alone is completely mind blowing. Like, I had twins and it was 5 minutes. You
yeah,
know, 45 minutes is an incredibly long amount of time. And I mean, we talked a little bit before, and I think this is really important and interesting to kind of talk about that interplay between um giving birth via C-section and also in the context of the abdominal issue injuries that you had and kind of ongoing issues. I think that was, you know,
yeah.
huge for you.
They did a classic C-section. And again, they knew it was going to be complicated. So they took me into the operating room, completely conscious, and did everything that they could possibly do before the point of making the incision. And it was classical incision. They went through a previous scar that I already had. Um, Everybody came into the room that was going to be kind of working on me and introduce themselves while I was in the operating theatre. And it was just amazing. I mean, it was what my 18, 19, 20-ish operations. And I've never had that experience because normally by the time you get in there, you're unconscious. So I felt really comfortable, kind of knowing people, knowing what was going to happen. I knew it would be complicated. I like 100% knew it. They also had a specialist gastroenterologist come over from a different hospital. So I had not just obviously the person who was going to do C-section, but somebody there from a gastroenterology perspective as well, hematology because I'm on blood thinners. I'd had some really good conversations with the anaesthetist, so I just felt really well informed and well prepared. I felt like I was in capable hands.
That's so nice. I mean, it's so real. I mean, I just think it's a terrifying thing anyway. And you're thinking not only about this, procedure and how potentially complex that's going to be, but then next you've got, you're going to be sent home with a real life baby that you've got that you've got to look after, and you're thinking a million different things to feel that support in that moment is amazing. Um, you're just the level of calm that you exude is beyond me. It
It's
really
done
is.
now. But yeah, it
So
was good. And then once he was here, he went on to NICU and or SCBU.
yeah.
And yeah, I was a bit naughty that night actually because I came out of surgery about 6 p.m. My consultant had told me explicitly I shouldn't be getting out of bed, but the nurses came round to mobilise me at 4 o'clock in the morning. And obviously I thought, I'm going to get to see him. So I knew I shouldn't. Um, but yeah, I mobilised and went to see him. And I should say as well, they let my mum stay in the labour room with me for the whole time that I was in. Because Jensen was in, I think it was in 19 days, and I was in maybe 10. And yeah, my mum was there so she could support me from a. So, and I felt, again, it was like different to any other hospital admission I'd had before. Because for things like personal care, I didn't have to buzz and ask the nurses. It was, I could just ask my mum, and she knew because obviously she knows me. So it felt like I was much less of a burden on resources just by having and I've never had that option before anywhere.
Yeah. And how old? I'm trying to calculate about how old was Jensen now?
He's 3
Okay. So you had him in 2023.
to 2022 October, yeah.
So you were kind of, I mean, obviously COVID was kind of probably still talked about, still an issue, and I mean obviously it still is, but you didn't have that level of restriction that you would have had 2 years earlier, um
No,
which is a massive blessing. Having your mum there, I mean, is amazing.
yeah.
So 19 days Jensen was in hospital, and then everybody sent home, and now he's
Yeah.
3. So
Yeah.
I wanted just to reflect upon kind of your motherhood journey. You've already alluded to kind of difficulties that you and your husband had anticipated as being spinally cord injured parents. And I wonder whether you would just talk a little bit about that, what you found kind of maybe easier than expected and what you find more difficult than expected, or just things that you hadn't expected at all.
But I found the whole thing probably easier than I expected. And again, I don't know if that's partly because Jensen was small. But so Nathan has got lots of friends who are in trade. So his best friend had made us a changing table, which was essentially just two sets of drawers with a top on that could fold down so I could wheel underneath it. But it also meant that positioning wise for changing Jensen at that time, it made it so much easier for me.
Mm.
So we'd anticipated that, obviously, made an adjustment. We bought a cot that Nathan could, because Nathan's fingers don't work. Um, so, and he's got limited arm movement. But because the cot is like a lift and move and then drop side, he can operate the cot. Same with the next to me and things like that. It was just sort of setting up, getting prepared. Um, I used to put his baby bath on the toilet when he was really tiny because it was like the best level.
Perfect height.
Um, yeah, so in terms of like getting him in and out, because my obviously stomach muscles I've had quite a lot removed, um, so my balance isn't amazing. But yeah, it was just kind of working things through as difficult things came up. But overall, I just loved it, and I thought it was a good challenge to have. We have challenges throughout life as spinal cord patients, but this was like the best challenge.
Oh my goodness, I love that. And I mean, I was kind of surprised when we talked originally. I was kind of surprised when you said to me, I found it easier than I thought I would. And I think that is so encouraging for women who might be in a similar situation to you know, pregnant or getting ready to have a baby, or having all, thinking about all of what you went through in your IVF journey, pregnancy, everything that you had to deal with, and to come out the other side and then to be able to say, it was manageable. And part of I guess your planning and discussions and everything that you did in advance was contributed to it feeling easier. But I think that's huge. Like, I think that's you can't underestimate how reassuring that might be to somebody in your position that might watch this. That's
100%. And a lot of the things that come, I think, with motherhood, like the sleepless nights, I was having that pre-Jensen anyway, because, when you've got spinal cord injury, I've got to wake up to turn in the night anyway.
mm,
So I'm just spending, instead of just waking up to turn, there's a purpose to waking up. So it almost felt like easier waking up with him um, than it did in my normal kind of routine. Um, Obviously, like choosing pushchairs, prams, and things, it's just go out, try what's there.
yeah,
I thought about how I would kind of travel with him inside the house, outside the house. So obviously, like there's baby carriers, but we thought about specific ones that didn't have kind of metal that would stick into our backs, and
yeah,
so there's things to think about, but nothing's insurmountable.
yeah.
And I like with Jensen, honestly, I needed very, very little help, if any, to be honest.
That's
Which was just
I feel
because you
like you
don't.
should write a book or a guide or something for people at the most frightening time of life. To have that reassurance is so, so helpful. Did you do, just out of interest, did you do much kind of um Googling about, I mean, this is my like absolute toxic trait. I Google for absolutely everything. But I wonder, what was there, were there resources? Did you find anything particularly helpful? Is there anything that you would recommend to women in your position or a similar position?
I did Google. I didn't find that much. There's some companies that are doing prototypes of things like pushchairs that attach to wheelchairs. But again, thinking about that, I didn't think it would work for me just because how I move and how I use my chair. So I think, yeah, absolutely Google away. And if you find something that you think might help you, look into it, follow it up. It would have been useful for me if there had been other people that I could speak to about it, because I think it's that personal circumstances, that kind of connection that you have with people to be able to understand their experience, get kind of hints and tips would
Yeah,
have been good. Because obviously the internet is amazing, and there are some stories, but I think from a spinal injury perspective as well, we're all fairly unique.
yeah,
So you've kind of got to take as much information from wherever you can get it, but also create your own journey and not get too hung up on that person's doing this, that person's doing that. It's about you and what's right for you.
yeah. And I think that is like, as you said, it's kind of, to an extent you can plan for all of those kind of practical things, but to an extent it's about trial and error, isn't it? And I was thinking as well, not just about kind of the practicalities of it, but I was thinking about as well that journey that you had through IVF and through pregnancy, and kind of knowing, I mean, this is the dream, isn't it? Having like a map of who to ask when certain things arise. And but as you say, every spinal cord injury is so bespoke. Everybody has their own kind of issues. And I think that's one of the reasons that we're doing this today, is to talk a little bit more about, not to give all the answers, but to give your kind of unique perspective and things that work for you and things that could have been done better, and focusing on your experience as a starting point, I suppose. Um and so we've covered kind of tips, I think, for other kind of pregnant women, or women that are wanting to pursue families. I wondered whether you had any advice for the kind of clinical people, I suppose across your experience of various stages. Are there any kind of practical thing? I mean, you've alluded to so many already, Nicola, but just kind of, I suppose, in summary, what would have been good conversations for you to have, or any kind of hints or tips. We like the practical stuff. We want takeaway.
From an initial conversation perspective, it was really difficult for me to kind of navigate relationships initially, having no kind of understanding of the potential of me to have children. So it was almost like it felt like the clinicians at that time had made the decision that it wasn't the right time for me to know. And I think just having that conversation, even if they'd said at that time, well, we don't know, but we can look into it, or, would have kind of made me feel a lot more comfortable
Yeah,
um,
yeah,
and informed moving forward, just in a much better place rather than basically a big void. And again, that kind of multidisciplinary team at that kind of planning point, I think understanding some of the allocation of responsibility, again, when I had the miscarriages in that medication scenario, was probably one of the most difficult times. And it happened twice, not just once. So the second time um, that I became pregnant, I went through exactly the same issue in that nobody would take responsibility for changing those meds.
yeah,
So I suppose it's somebody's got, if I were in that scenario now, somebody would need to do something. It just needs to be, identified. Who, I suppose. But again, it's those conversations with individuals, isn't it? It's
yeah,
understanding everybody's different. This is what your needs are. Let's have an open conversation about it. Let's not be scared to ask difficult questions, because I'd rather have the hard discussion and know what was to come than be in a difficult scenario at a time when actually we can't do anything about it.
yeah, yeah. And that in itself is so valuable. Nicola, as you say, you're not asking for a perfect answer, just to, hear you. And that I think that goes for across the board, Nicola, it's a on its own, sexuality, reproduction, intimacy, those are just tricky topics, aren't they? And
Yeah,
everyone's different. Some people are comfortable, some people are not. And just in and of themselves, they're difficult topics. And then to have this kind of layered and complex experience makes it even more difficult. But listen,
100.
I cannot thank you enough for sharing all of your experience and so much detail. I'm sorry if I've grilled you. We've ended a little bit early, which is absolutely unheard of for me, by the way. But I've worked really hard to keep us on time. But I have left a few minutes if anybody had any questions. If you don't mind, Nicola,
Yeah, of
you can
course,
pop
yeah.
them in the Q&A box. And we'll stay on for a minute or two to answer any questions. But I think that was so helpful, Nicola. And this session, as I say, is part of a series. We will be running a series on sexuality, intimacy, and reproduction. We'll deal with male health, female health. We'll deal with all sorts of issues from different perspectives. And as I said at the beginning, one of the things that people had said to me, mainly clinical people again and again, the person who has the first-hand experience knows best. And it is just so interesting to hear from you, Nicola. I'm so grateful to you. I'm
Oh,
waiting
well,
to see. There's so many lovely comments coming in, but I haven't seen any questions. In fact, need to make sure I know how to use the Q&A. Oh, here we go. Oh, we do have a question, if you don't mind, Nicola, which is from Emma, who says, I'd love to know what pieces of equipment were useful to advise her clients. And she's asked for some contact about that. So I'll link you up. I'll link you up separately,
yeah.
and you can have a think about that. And someone's asked, you said you were advised not to have another pregnancy. Did you discuss the surrogacy option?
So, no, we didn't, but I was advised not to have another pregnancy because the operation was so complicated and took so long. It was advised, I suppose, to protect me um, pretty quickly after the surgery had ended. I think it might have been the next day. They'd had a chat collectively, and it was like, oh, I've been. I said I'd come and speak to you about it. But at that point, I was like, he was absolutely fine. There was no kind of adverse effects from him being small or from the fact that, because obviously the drugs transfer to him when they put you to sleep. No adverse effects from that. So I had a healthy baby. So I was at that point like, yeah, absolutely fine. I've got my baby. I'm okay.
You've got your family.
Yeah.
And do you know what you've got just around the corner as well, Nicola, is school.
Oh yeah. Yeah.
Which is just a new set of challenges, but it
Yeah.
sounds to me like you'll absolutely smash it.
Yeah.
Um, Again, thank you so much. Nicola, I can't thank you enough, honestly. So grateful. I'll make sure that the recording's going to be available to everyone. So if anyone has any colleagues or friends or people affected that would benefit from seeing it, please do share. And you can contact me directly if you've got any queries on the back of this, and putting you on the spot a bit, Nicola. But if anybody wanted to kind of pass on a question through me or anything, that'd be okay.
Absolutely. Yeah, definitely.
Amazing. Well, thank you so much to Nicola, most importantly, but also to everyone who joined today. I hope it was useful. I know it was for me, and super interesting and helpful. So everybody take care, keep your eyes peeled for the next installment in the series. We'll let you know as soon as we are ready to share all the details. And thank you ever so much again.
Well,
Thanks,
thank
Nicola.
you.
Take
Bye.
care.